Family caregivers are the foundation of the intellectual disability system and support their loved ones with disabilities as they live, work, and thrive independently in the community.
This is a photo of Silas. Silas has a rare genetic disorder called SMART, spinal muscular atrophy with respiratory distress.
My son is Joshua. He's 29. He has cerebral palsy and medically complex needs.
I have a son with cerebral palsy who is 37 years old. He lives with me, and I have been his main caregiver / manager for most of his life.
He can't walk or talk, eat on his own, or even breathe on his own. As you can see, he has a trach with a ventilator attached, which breathes for him. The only muscles he's able to use are his face muscles, which is why you see this beautiful smile on his face.
Due to waiting lists and inadequate funding, about 75% of people with intellectual disabilities live with family members and do not have access to residential services. These family members take care of their loved ones day in and day out with little to no support.
What is the hardest thing about being a caretaker for me? It's that it informs everything I do, whether it's attending a business meeting right now via Zoom, or trying to run an errand, or even just meeting a friend outside on my front lawn. I have to think about how it's going to impact him.
Trying to find time is the hardest thing. Getting everything done. These doctor visits, my other children need a doctor visit, they call and they pick up the phone. They're younger than he is, but they're all adults, and if they need to go to the doctor, they pick up the phone and make an appointment. Whereas my son Chet probably has 5 or 6 doctors he sees once or twice a year. And that's if everything's working well. If there's an issue, a problem, we could go see double that number easily.
The lack of nurses available is definitely the greatest challenge. And along with that is the lack of hours provided. Although we do have a decent amount of nursing hours, private insurance companies will not pay for private duty nursing or home nursing for people like Silas, even children. Therefore, Medicaid does pick that up, does pick that benefit up, thank God. But there are a large chunk of the day where we do not have nurses.
Having time to take care of myself and visit with friends and take a break, never enough time for that. Time to be with my other children. Time to find caregivers and interview them and train them and get them set and learn how to take care of my son.
In Pennsylvania, there are 4,978 people with intellectual disabilities on the emergency waiting list for services.
One of the greatest obstacles to being a family caregiver is locating and retaining skilled nurses, skilled nursing care of the highest acuity to help us take care of Silas.
This is a very difficult time mentally that we're going through, the isolation with COVID. I have not had help in my home because of COVID, but we're starting to think about it. But finding the right person, a person that we can really trust, is a priority and very difficult, quite frankly.
The reason it's such an obstacle is because the nursing agencies do not provide comprehensive health insurance plans. Therefore, most of the nurses have to find other jobs, such as many of them work in the local hospitals, to pay for their health insurance, or they rely on their spouses. This also is a compounded issue because of COVID, or I should say COVID compounds this obstacle, because for instance, if one of the nurses who works in the hospital has been exposed to COVID, they need to quarantine, which means that we have a smaller pool of nurses to fill in for us. Also, the incentive for them to be tested and quarantine, even let the agency know that they've been exposed, the incentive is not there because of the inability of the nursing companies to pay for them, the nurses, if they're losing days. So for instance, if a nurse has the sniffles and wants to be tested for COVID just to be sure he or she doesn't have it, the nursing agency requires them to use their paid time off, PTO, which they usually only have a week. Therefore, they're more likely to come to work with the sniffles than to be tested for COVID.
577 caregivers care for more than one family member who is elderly or has a disability, and 1,268 are single-family caregivers who provide care without support from another person.
What worries you the most about the future? My health, whether or not I'm going to be here.
If my husband becomes sick or I become ill, it all falls on one of us. I don't know how single parents are able to do this. I really applaud them. We are fortunate in that we do have each other, but even with the two of us, we become very burned out very quickly.
My husband passed away a couple months ago, and now the primary responsibility is completely on me for the care of my son. So that is a big worry. But in the short term, if I were to hurt myself or get sick, that would be a big problem. And I would need to figure that out, how to handle that, and that would be hard.
I hope that I find caregivers that will stay with him for a long time, because new ones are very difficult to transition, and he loses a lot, and he gets such good care because it takes a long time to learn who he is and what his needs are. And when you turn over caregivers quickly, it makes that very difficult. It makes caring for him very difficult because nobody knows what he's doing.
The lack of hours, the lack of nurses, just in general, that type of physical support creates quite an obstacle when you're a family caregiver.